Hi everyone. In today's video, I'm going to be going through two main processes that occur in heart failure, and these are left heart failure and right heart failure. Now, the thing with these two types of heart failure is that they can either occur at the same time, which is called biventricular heart failure or congestive heart failure, or they can happen separately, and interestingly as well, they can cause each other. Now, the first type of heart failure that I want to talk about is right heart failure. Now, right heart failure is when, as the name suggests, there is a decreased ability of the right side of the heart to pump blood effectively through the heart into the lungs from the body. So, in terms of right heart failure, instead of hypertrophy necessarily occurring, we usually see dilatation or dilation of the right ventricle. Now, this can be due to a lot of effects, and causes can include cor pulmonale, and cor pulmonale is when there is hypertrophy of the right side of the heart, and when this hypertrophy occurs, it's usually due to pulmonary hypertension, and that can be due to pulmonary fibrosis, which can be due to an infection. It can be due to maybe cystic fibrosis if the patient suffers from a lot of upper respiratory or lung infections. So as you can see, right-sided heart failure is usually due to lung symptoms, but its effects or the actual symptoms of right heart failure are not seen in the lung. They're seen in the periphery. So what are the symptoms of right-sided heart failure? Well, think about, since the right side of the heart is not working properly, then essentially there's a lot of blood being backed up in the systemic circulation. And if you can think about the effects that can cause, well, essentially we'll see effects around the entirety of the body. And these effects include edema, and that makes sense because essentially, since a lot of blood is being backed up in the systemic circulations, a lot of blood is leaking out of veins in terms of plasma, and that plasma, since it can't go back into the systemic circulation effectively, it's being backed up in tissues. So that can cause ankle edema if the patient is spending a lot of time standing up, or it can also cause sacral edema, which is when the patient spends a lot of time in bed, and purely due to gravity and the orientation of the body, the edematous fluid gets trapped in that sacral area. If that heart failure becomes quite serious, then it can result in ascites, which is edema that occurs within the peritoneum, and that can have a lot of effects on abdominal organs such as the stomach, intestines, and it basically, by putting a lot of pressure on those organs, it can reduce their function. Now, as I've mentioned before, because there is an effect on abdominal organs, symptoms of right heart failure can include a loss of appetite. Other symptoms can also include tiredness due to a lack of proper flow of blood throughout the body. And usually we don't see peripheral cyanosis like left heart failure, but peripheral cyanosis can be present in right-sided heart failure. Now, an interesting thing to note is that right-sided heart failure can cause left-sided heart failure, but this is extremely rare and it's not usually seen clinically. Now, the reason why right-sided heart failure can cause left-sided heart failure is because when you think about the cardiovascular system, it's basically one whole closed system. There's not really a conduit or an exit pathway for the blood to pass through if something gets clogged, and that's why infarctions occur, because if an embolus gets stuck in a particular part of the body, well, that part of the body isn't able to receive the appropriate nutrients and oxygen it needs to effectively operate. And the same theory or the same principle is present here in right-sided heart failure. if enough blood, and you really have to be, quite deep within the progression of right-sided heart failure for this to actually happen, but if enough blood gets backed up within the systemic circulation, then that can have a negative effect on the left side of the heart because it's flowed and backed up so much. So say, for example, if we have the heart here, and this is the right side of the heart, left side of the heart, and systemic circulation here, very crude drawing. If enough blood backs up such that the left side of the heart is affected, then, well, that causes left-sided heart failure, and therefore we result in congestive cardiac failure or biventricular heart failure. Now, as I mentioned before, this is a very, very rare finding, and it's extremely, I would say it's never seen clinically. So that's right-sided heart failure. Now, moving on to left-sided heart failure, this is, I would say, I wouldn't say more common, but it's what you would stereotypically see or stereotypically think of when you think of heart failure. Now, left-sided heart failure can be caused by many things. Now, applying our principle that we applied in right-sided heart failure, the causes of right-sided heart failure relate to the lungs. However, the effects are on the systemic circulation, and the same principle occurs here. The causes of left-sided heart failure are in the systemic circulation, but the symptoms are on the pulmonary or the lungs circulation of the body. Now, the causes of left-sided heart failure include maybe there is some obstruction in the systemic circulation, and this can include maybe an embolism, and this is a very acute type of left-sided heart failure. Hypertension can cause left-sided heart failure. Any type of cardiac fibrosis, and that being said, cardiac fibrosis can also cause right-sided heart failure. And any condition where, say for example, there has been constant exposure to maybe a high pressure blood, and initially that causes hypertrophy, but eventually that can also cause dilatation of the left side of the heart. So now, what are the symptoms of left-sided heart failure? Well, as I mentioned before, since the causes are systemic, the symptoms have to be pulmonary. So the symptoms of left-sided heart failure include a condition called P&D, and I'm just going to write orthopnea next to that. Now, what are orthopnea and P&D? Well, orthopnea, if we think about the word, ortho means a particular orientation of the body, and nea relates to the lungs. In this case, orthopnea means when a person with left-sided heart failure lies down on their back, usually they experience shortness of breath. Now, why does that occur? Well, essentially because left-sided heart failure is when the left side of the heart can't pump blood effectively around the body, the buildup of fluid becomes so large within the lungs that when you lie down, that fluid spreads across the lungs and causes for alveoli within the lungs to be full of fluid, so that they can't effectively allow for the flow of blood, the exchange of gases within the blood to allow for oxygenation and the removal of carbon dioxide. And that causes shortness of breath when the person is laying down, which therefore means that they experience orthopnea. P&D, or paroxysmal nocturnal dyspnea, is, as the name suggests, a shortness of breath. And this paroxysmal nocturnal dyspnea occurs usually when the patient has already fallen asleep. So these patients don't or might not experience orthopnea. And after a few hours of going to sleep, these patients wake up in the middle of the night gasping for breath, and they are forced to essentially sit up, because if they don't, they risk potentially stopping breathing. And usually what happens is that after they wake up and after they sit up, after a few minutes after they've done that, they can go back to sleep and sleep for the rest of the night. Basically, what has happened here is that after the buildup of fluid within the lungs, they've essentially cleared that fluid, and essentially by sitting up, and after they lay back down, it takes a little bit of time for that fluid to return back into the lungs. And essentially what happens is that since the fluid or the accumulation of fluid within the lungs is not at a great rate, they're able to survive the night without having to wake up once again. However, as this condition worsens, then orthopnea can result, and paroxysmal nocturnal dyspnea can worsen, so that they can wake up in the middle of the night gasping for breath multiple times. Now, as I mentioned before, other symptoms of left-sided heart failure include peripheral and central cyanosis, and interestingly, there is also muscle wasting, because if you think about it, the muscles of the body are not receiving an adequate amount of blood, and therefore they atrophy, because if you don't use a particular muscle as much as it needs, or if the muscle is not receiving enough nutrients, then essentially the muscle atrophies because it thinks that it's not being used anymore, and therefore it's homeostatic to not have something as large as it is supposed to be if it's not being used. Other symptoms can include shortness of breath. As I've said before, there is an accumulation of fluid within the lungs, and therefore usually the person clinically presents as sitting forward within the chair, because sitting forward actually assists with moving some of that fluid away from the bases of the lungs and allows for the pressure gradient, or the gradient of the flow of air, to be smaller, therefore allowing for a more effective flow of blood throughout the body. And other symptoms include the loss of weight, and there's not usually any ascites or edema, because there's not the accumulation of fluid within the systemic circulation as seen in heart failure, right-sided heart failure. Now, as I've mentioned before, right-sided heart failure usually doesn't cause left-sided heart failure. However, left-sided heart failure usually, or more commonly, causes right-sided heart failure. And the reason for that is that since the left side of the heart can't beat as effectively as the right side, the accumulation of fluid only has to pass through the lungs to allow for a failure on the right side of the heart. And I think representing that diagrammatically is more effective. So if I have the right side of the heart here and the left side of the heart, and we have the lungs, so the left lung and the right lung, so the trachea is here, and let's just do a very crude diagram of the pulmonary vessels. So as we can see, the left ventricle, which is present here, has the job of pumping blood to the systemic circulation so that it can return back to the right side of the heart. However, if there is inadequate pumping of this ventricle, then eventually the blood starts to back up through the left atrium, slowly start to go up through the pulmonary vein and into the lungs. All right, so that's what we see in left-sided heart failure. But as you can see, compared to the systemic circulation, which is this big part here, the pulmonary circulation is very small. So it's very easy for left-sided heart failure to precipitate as right-sided heart failure. So as this fluid accumulates, and its level might even increase within the lungs, it accumulates within the right pulmonary artery and into the right ventricle. And eventually that causes dilatation of the right ventricle because it's receiving more fluid than it would normally have if the right side and left side of the heart were working properly. So it dilates to accommodate for that increase in fluid. Now this dilatation is pathological because if a dilatation occurs, then the contractility of the right ventricle is compromised. And if the contractility of the right ventricle is compromised, then this essentially means that the ventricle is unable to pump effectively the blood in the systemic circulation. And therefore, left-sided heart failure causes right-sided heart failure, which presents with all of the symptoms such as edema, ascites, a loss of appetite, and other symptoms as well. And that causes congestive or biventricular heart failure. So in review, we firstly looked at right-sided heart failure, which is caused by right-sided dilatation, which causes systemic symptoms due to pulmonary causes. And then we looked at left-sided heart failure, which is due to systemic symptoms, and it causes pulmonary effects. And eventually, left-sided and right-sided heart failure can both cause biventricular heart failure, but left-sided heart failure causing this is much more common because of the short or the small nature of the pulmonary circulation as opposed to the systemic circulation. So I hope that all has made sense today. Thank you very much for watching.